It's Winning Wednesday. It's Winning Wednesday. If it's 9 p.m. back home, then it's 4 a.m. here in Nairobi. Winning Wednesday. We are going to talk about liver cirrhosis, but Mark and I, we have been here in Kenya for several days now, and we are making tremendous progress helping nurses here get the pathway, get the information that they need to come to the US. And our days are long, our nights are long, and I'm just so grateful for all the prayers. I just want to personally have Mark come on and just even now, even now, even now, you gotta get that. Even now, we're in our hotel room, and we've been away from our kids, and we have Selah here, and y'all, we've been moving all over so much that I forgot her blanket. I just been just trying to get to the next destination. So she's literally, if y'all see she's wrapped up in a bath towel, don't come for me. I'm doing the best that I can. But the the response has been tremendous in terms of nurses needing to know what they need to do to pass NCLEX, what they need to do to sign up, to prepare, what exams are mandatory. If you already are a nurse in your country, what other additional requirements are needed to come to the United States. So we know NCLEX is a huge one. The purpose of NCLEX for everyone, even if you're US educated, is for safety. It's a safety exam. And when you come to the United States, because you have so much responsibility, have so much value in the healthcare system, you just want to make sure you're safe. So that's it. We're going to do liver cirrhosis. Mark, what else?
So welcome once again to Remar Review. If you are just tuning in, this is a live NCLEX review with the #1 NCLEX instructor.
Hello.
And mother.
Hello
and
there.
Wife.
Thank you.
On the planet, Professor Regina MSN RN. And we are here to help you as a Remar nurse accomplish your nursing goals, your nursing dreams, to take your career to the next level, or figure out what that level is that you can actually go to. Because we are literally traveling around the globe.
Yes.
Traveling around the globe.
For you.
To show you what nursing can do and what God can do for you. And so we're just so excited about the stories that we're hearing on the ground in Africa. Some of the plans that are being made to help nurses from Africa come to the U.S. and to help some of you guys in the U.S. come and visit the motherland as well.
Ooh,
and so
that's true.
We have some amazing things in the works, and God is just opening up doors. And so we just wanted to come and share with you on today, Winning Wednesday, what we're doing to win as a family, as a couple, as a business, as a nurse educator, and also as a president and chaplain. We're just sharing the best of what we have with you. So now, welcome to Winning.
Wait! Before you do that, though, I think it is important for the nurses to see that when you have a big dream or a big vision, it does require some sort of sacrifice. And I think it's very real for us to be on here tonight, very tired, very hungry, but at the same time, knowing that like everything that we're doing is building upon the dream that we have. And God is really going to do it because we see him giving us favor in different, in different ways. But it's not easy to do something new. I think that's the challenge of getting out of your comfort zone. So if you're watching this and you have a big dream, either to come to the U.S. or just to pass the NCLEX, it is going to require some sacrifice. And your life should look different for a certain period of time as you're preparing for your goal to get you to the next level. And really, it's not about you. Like, it's really not about you. It's about who you're going to give the advantage to, whether it be your children or your parents or your community. Like, you are doing something for a purpose greater than yourself. So that's it. That's what I want to say about that. We are on the grind. This is what the grind looks like.
All right. Are you ready to deliver some content, some questions in addition to the motivation?
Always. I'm always ready to go. Listen.
All right. So are you ready to receive the content, answer the questions, and act out the motivation, guys? It's not just about coming to these classes. It's not about just logging in a YouTube or Facebook. It's about actually taking the steps to work out, to discover what your dream, your passion is, and to live that thing out. As Regina said, Professor Regina, it does take sacrifice. And so we thank you for being here with us on this evening. And so now,
evening.
It is time for our Winning Wednesday.
Can you introduce the topic? Do you know about this topic, Mark?
This topic is liver cirrhosis. Cirrhosis. All right. We're going to have an NCLEX review and then follow by questions. NCLEX review followed by questions on the topic of liver cirrhosis. And we're going to get right into it.
Okay, cool.
Okay.
You want to take baby?
I will take
People
baby.
always asked about Selah. Hey, man.
No, I was about to say get into the topic.
Oh, you was about to introduce that part?
Yeah.
What were you going to say?
Well,
okay,
I was going to say
just go ahead,
that the liver is an amazing organ.
Okay. Yeah.
Right? The liver is an amazing organ. And then I was going to ask a question about, do the cells in the liver regenerate?
Look at you.
And that's something that you want to know.
That is something that you want to do. Mark, actually, that's a great way to start it off. We're going to be talking about liver cirrhosis. So think about the liver and this great question, do the cells in the liver regenerate? What are they saying? What do you know? What do you think?
Do the cells in the liver regenerate?
Yeah.
Like after they've been damaged?
Exactly.
Ooh.
Do the cells in the liver regenerate after they've been damaged? Because when we talk about liver cirrhosis, we have to be able to explain to our patients their actual condition and the seriousness of it. And so the Remar nurses are putting in the comments, if you said that they do, then you are right. Isn't that amazing how God made the body?
That is.
It can withstand our abuse. It can withstand the environment, and it even has the capacity to regenerate itself. So if the liver can regenerate itself, how does a patient go from a healthy liver to liver cirrhosis, a very damaged liver, if those cells are regenerating? That's the question that you have to understand and know before you take your NCLEX exam. So the reason is this, and I'll read it to you. Liver cirrhosis is a progressive disease. That means it gets worse over time, and it is caused by not one time, not two times, but repeated damage to the liver over that time. And so what happens is the liver begins to scar, and that affects how the liver works. So a liver cirrhosis, it's a very tough, fibrous, scarred liver. And although the liver can regenerate, that scarring can be so severe that it just becomes permanent. And so that is potentially what leads patients to liver failure. So if you learned that today, then that's why you came to class. All right. Did you learn something?
I absolutely did.
That's my whole entire point. That's it. So liver cirrhosis is a scarring. It's an unusual scarring of the liver. And so, like I said, it was progressive. You have hepatic fibrosis. Also, you have a change in the architecture of the liver. So that means the shape of the liver is going to be different in liver cirrhosis. You'll be able to see that on any kind of anatomical scan. The hepatocytes, these are actually the cells of the liver that are regenerating, that are trying to be healthy, but because of the scarring and the repeated damage, those hepatocytes can no longer perform their function. And so ultimately they begin to die. And that's why you have the necrosis of the liver cells. Such a serious condition. But really, when we go over the foundations of it, we become more confident. Now, I do have some tough practice questions coming up. So see if you can hang with me during this Winning Wednesday. Clinical manifestations, how are our patients going to present? Well, we have, oh no, I don't want you to take Selah. I don't want you to. I haven't gotten to see Selah all day, really. And no, she's sleeping as my little angel. I want you to take her, but I know you must take her. So bye, Selah. I will see her later.
Okay.
All right, back to class. All right. So The symptoms, we're looking at symptom presentation, a physical examination, and then laboratory tests. When I was preparing this class for you guys, I felt that of the three of these that you really needed to understand, the laboratory tests are going to be the most significant. So let's just talk about the symptom presentation, because the liver is so important with your metabolism and your health. The patient is going to report symptoms of easy bruising, jaundice, which we understand that yellow discoloration, pruritus. What does pruritus mean? Pruritus, yes, they're going to have skin itching, ascites. In women, they will have amenorrhea or oligomenorrhea, right? And in male patients, they will have impotence. And that is just because the body is beginning to be diseased. If you have an organ that is essentially dying, then it is going to affect all the other components of a healthy lifestyle. You have an organ that's like, it's festering in the body. On a physical examination, you're going to have this very long word. What does it mean? Hepato, splenomegaly. Oh my goodness. Long word, but we know that megaly, what's the term for megaly? Megaly, big. So the liver is going to be big. The spleen is going to be big. And that is what is going to, having that splenomegaly, that's what's going to cause our patients to have issues with their platelets, okay? So being able to pass NCLEX is so much more than going to nursing school. I would say in some instances, even if you've gone to nursing school, it still may not be enough, because you have to see the big picture of nursing. You have to be able to make giant leaps from one condition and how it affects the body in the next situation. So yes, we're talking about cirrhosis, but these patients have low platelets. Why? Right? And so you got to be able to make that connection from liver cirrhosis to the spleen to low platelets. Okay. Spider angiomata. What is that? Spider angiomata. We're talking about physical examination. So this is something that we're going to see. We're going to see the little spider veins on our patient's hands. Okay. Dupuytren's contractures of the hands as well. Gynecomastia in men. Axoteric flapping, which is the flapping of the, it's like flapping of the hands that happens. Infector hepaticus. And that is a classic sign of a bad breath. Patients with liver failure, they have a musty odor to their breath, and it is simply coming from the inside out. Our laboratory tests that are relevant. Are y'all sticking with me tonight? Are y'all sticking with me? I appreciate you being here. The amniotransferases, important. The PPTs, elevated INRs. And as I'm saying this, before I give you the answer, think about what these exams mean. Because remember, it's not so much important to have numbers memorized. NCLEX is not a memorization test. That's like the surface level of understanding. Can you memorize? We're at analytical. We're at the upper level of thinking. Can you create? Can you analyze? So albumin. How does albumin relate to the liver? Where is that coming from? Why do we care about the albumin of the patient? Great comments, great comments. Thank you so much, you guys. Hyperbilirubinemia. What does that have to do with it? Hyponatremia and the complete blood count. These laboratory values, so crucial. When you get a patient, they come in with a history of hepatic liver failure, right? Any kind of that. You want to look at these laboratory values immediately. If the doctor has not ordered them, you need to be calling the doctor and saying, hey, I need a liver function test. I need a CBC on this patient. Or when are you coming to do rounds? Can I put in for an INR, PTT? My patient's taking, warfaring at home. Like, you have to be able, you have to be able to be proactive. And that's one of the reasons why nursing in the US is such a high calling, because the responsibility to save a patient's life, and some people might not like when I say that, this is on the nurse. It is the nurse that is saving the patient's life, because we are there. We're there. We're the first ones to know the changes. You're not going to be a nurse in the US, right, and not be able to make the correlation between a CBC and somebody who has, anemia. Like, you have to be able to make those correlations and call the doctors and have a voice. That's what it is. When you pass the NCLEX, it gives you a voice to protect based on your knowledge. Okay. So here we go. And this might be a little small, but let me just read it to you. So why we care about the laboratory tests, the elevated liver enzymes, these are particular. You will see them when the liver is damaged. So when you have increased ALT, AST, okay, I'm working with somebody that has some level of liver damage. And that means that now I have to monitor not only your liver, I have to monitor your blood count, I have to monitor your diet, I have to look at your skin. And so the complexities of nursing, and I know this is like my hobby horse today, but this is why you can never plan out a shift in nursing. This is why every shift in nursing will be different. And if you think that nursing is something that's going to be routine and you're going to be able to just casually do and not prepare for it, no, you're going to need continuing education. It's rigorous. Increased bilirubin. How does bilirubin present itself increased if a patient has liver failure? What's the connection? The connection is bilirubin is a byproduct of what? Red blood cells that are broken down. Now, usually it's the liver's job to process that bilirubin, because bilirubin is something that's normal in the body. You're going to have it because red blood cells live for how long? Somebody put in, I know that's in quick facts. Somebody put in how long red blood cells live. Look in the comments right now. You should know it. You don't know it, I'm not telling you. You should know it. They only have a lifespan of a certain amount of time and then they die. That's normal, right? The liver's job is to get rid of it. The liver is scarred and diseased. You'll have a buildup of bilirubin. And so this is where jaundice comes in. Okay. Jaundice is caused by that bilirubin. It's common in patients with cirrhosis. The albumin, we talk about protein levels, we talk about albumin in nutrition, but it's the liver that is making the albumin. Yes. And so that protein, it helps in a lot of things. Maintaining fluid balance is important. So when you don't have a lot of albumin, it can indicate that the liver is not functioning. Okay. Prolonged prothrombin time. The liver produces the proteins that are needed for blood clotting. Okay. In cirrhosis, clotting factors decrease, okay, which can lead to longer clotting times. Low platelet count. Of course, cirrhosis can cause splenomegaly, and this can lead to a drop in platelets, which are necessary to help for blood clotting. So connecting the laboratory values to your actual patient's physical condition, very key, very key, very key. Okay, diagnosis, if we suspect it, if we detect it, if we confirm it. So suspicion will be based on a patient's presentation, their clinical symptoms, and how you will be assessing them. We'll also be looking at the laboratory findings. We might have some Bonaccini cirrhosis, and we also may look at an LOK index. I want you to write these things down and look them up, okay? Detection of it is going to be based on an ultrasound. You can also do a CT, an MRI, an elastography, or nuclear studies. Now, when it comes to diagnostic procedures, what is very important is the best diagnostic procedure that will give you the most accurate result the fastest. Okay. So if you have the ability to do a CT or an MRI, which one are you going to go with in an emergency situation? Think about that, Remar nurses. If a patient comes in, they need a CT, they need an MRI. You're in the emergency department. Which one are you going to encourage the doctor to write you an order for? You're going to encourage the doctor to write you that order for a CT. Yes, we want a CAT scan, because a CAT scan may take, by the time we get the patient down there, get them on the table, like maybe 10, 15 minutes, right? An MRI is very detailed, and it's going to look at the soft tissues, and it's going to give you a very detailed, picture. However, it takes a long time for an MRI. You're going to be waiting like 30, 40 minutes, and that's if the patient doesn't move. Then if the patient moves, they might have to start all over again. Go with the CT, okay? Confirmation is going to be liver biopsy. This is a surgical procedure. Need to have a consent form for any of the diagnostic procedures, but certainly for the surgery, having a consent form to check that liver, take a small piece of it for detection, and then also be able to challenge it, okay? Let's move this couch, hold on. All right, here we go. All right, so complications, variceal hemorrhage, ascites, spontaneous bacterial peritonitis, hepatic encephalopathy, hepatocellular carcinoma, hepatorenal syndrome, and hepatopulmonary syndrome. So, what are these complications? Well, these are all things that occur when the liver is diseased, okay? And you're going to have complications in other parts of the body. You're going to have complications in other parts of the body. So, variceal hemorrhaging. What does that mean? That means that now the bleeding is affecting the stomach and the esophagus. This is going to change the patient's dietary preference. This may cause the patient to be further malnourished. This may cause the patient to be dehydrated. Ascites. We know ascites is fluid in the abdomen. If a patient has fluid in the abdomen, this can also be an issue because we're not supposed to have fluid in the abdomen. So the patient has a real big stomach, and maybe people onlooking may think, oh no, that patient needs to lose weight, like that's fat. Hold on, let me change this. My back is aching so badly from okay, so no, that is fluid. That is fluid. And how are we as nurses going to help our patient get that fluid off? How is that going to happen? That's going to happen through a process of what? Diuresis. We have to diurese our patients. Okay. The third one is spontaneous bacterial peritonitis. Talking about the peritoneum, we see itis. That means there is a infection there, inflammation, and it's bacterial. So our patient's going to need what? What do we have to give our patient if they have bacterial peritonitis? Yeah, we're going to have to put them, very good, we have to put them on antibiotics. Hepatic encephalopathy, this is very important because when you have liver failure, not only does it affect the liver and the spleen, it also can affect the brain as well in a major, major way. So this is a brain dysfunction due to liver failure. This is one of the reasons why I wanted to go over this particular condition, because it is considered an emergency. Hepatocellular carcinoma, liver cancer. Hepatorenal syndrome is when the kidneys begin to fail. It's a link where the kidneys now are failing. And hepatopulmonary syndrome, okay? Lung problems due to liver disease. So sometimes I like to spotlight conditions that you did learn in nursing school and they're very common to you, but maybe you just haven't reviewed them yet. Our goals of care. So we want to try to slow the progression of liver disease, because I did say that it is a progressive condition. So over time, it does get worse. When we talk about the goals of care, thinking back to nursing school, is this primary, secondary, or tertiary prevention, right? If a patient has liver failure, or liver cirrhosis already, and we're trying to slow the progression of the disease, where are we at? Are we in primary, secondary, or tertiary? Okay, this is considered, yes, tertiary prevention, because the condition is already there, right? We're trying to mitigate the damage that it's doing. So tertiary. Preventing superimposed insults to the liver, which means like the liver's already damaged. We want to tell the patient, definitely stop drinking alcohol. If you stop smoking, let's get your health in order. Identifying medications that require dose adjustments or should be avoided entirely. Remember, one of the functions of the liver is that it metabolizes medications. So if the liver is damaged, what is the patient who is on a medication at risk for? That patient is going to be at risk for toxicity, drug toxicity, because the liver is not going to be able to metabolize and process that drug out like it's supposed to be. So patients may have to actually be removed from medications because of that. Yeah. Managing symptoms and laboratory abnormalities, our electrolyte imbalances, our CBC imbalances. Preventing and identifying and treating the complications of cirrhosis. We can do that. And determining the appropriateness and optimal timing for liver transplantation. So these are the things that we're going to absolutely have to consult with the doctor about. The patient, if they're a candidate for liver transplantation, we know that there are some examples where it's really successful. And then we also know that there are some examples where a transplantation is not successful and that new organ is rejected. So very serious condition we're talking about. Also, we are going to urge the client to consume high calorie, moderate protein meals. We have to be careful about the protein. Also, modest feedings. Okay, so not overeating. That's something that some of us struggle with, overeating. Promoting good oral hygiene before eating. Delivering or instructing clients how to self-administer drugs for nausea, vomiting, diarrhea, and constipation, which are common. And also promoting regular skincare. If a patient is reporting pruritus, you're bathing with soap and massaging with creams. And then also prevent pruritus scratching. Important. Keeping the fingernail short. Okay. Again, one of the ways that I prepare you fully for the NCLEX is through content, just like we're reviewing now. This is the quickest route to success for the NCLEX exam. And sometimes when a road is difficult, people try to find ways around it, go around it. You got to go through this one. Okay. You got to go through the content in order to be able to show up on NCLEX and answer these challenging questions. So V2, if you do not have it, I have a free trial of it. If you check out the website, remarnurse.com, you can get into my course. I know a lot of people had signed up, and actually so many, we had it kind of exploded on TikTok and with the quick facts books and other things. And so we have been waiting for a shipment of books to come in. So all of you who were waiting for the V2 workbook or waiting for quick facts, they are in. So happy to report that. So you will be getting your books in very quickly, very soon. So V2 is a combination of not only the online platform, but your physical books. And I believe your physical books are going to be your favorite. Okay. It's time for NCLEX questions, shall we? Let's go. Liver cirrhosis. Here's question number 1. A client with liver cirrhosis is experiencing increased abdominal swelling and shortness of breath. Which of the following is the most appropriate nursing intervention? Number 1, place the client in a supine position. 2, encourage the client to drink more fluids. 3, measure the client's abdominal girth. Or 4, provide a high sodium diet to maintain fluid balance. Got a patient with liver cirrhosis. They're experiencing increased abdominal swelling and shortness of breath. Which is the most appropriate nursing intervention? Tap, tap, tap in. I know you might be thinking, why didn't you put this on there? No, we have to be able to choose the right answer that's in front of us. Okay? If you did that, then you probably picked number 3. We're going to do some assessment here. That's the appropriate intervention out of the ones that were given to you. Measuring the abdominal girth is going to help monitor the severity of this ascites, okay? And that is the most important thing. Now, could it have said give oxygen to the patient because they have shortness of breath? Absolutely. But NCLEX is not always going to present those easy questions, and you have to be able to look at what's in front of you and choose the best answer. I'm moving on. Question number 2. During an assessment for a client with an early stage of cirrhosis, the nurse should focus on which finding? Number 1, confusion. 2, dysuria. 3, pruritus. 4, anorexia. Remar nurses, we are on the grind. This is what it looks like. The month of October is coming in like a lion. Seriously, it is really coming in strong for us who are studying for the exam. And I feel the excitement of everybody who has passed already. Okay, correct answer. Pow! Number 4, this is the focus for you. Anorexia. Why? Because I said the early stages of cirrhosis. And so in the early stages, you're not going to see the pruritus. You're not going to see the hepatic encephalopathy, the confusion. You're going to have issues where the patient's not going to want to eat. Okay. That's the first thing. It's like, oh, I'm nauseated. I'm vomiting. I'm constipated. I don't want to eat. This is what you should focus on. Look at these again. Confusion, late sign. And that's why I tell you, the answer is always in the question. It's always there. So you should be spending the most time here figuring out what you're being asked. Confusion, late sign. Dysuria, late sign. Pruritus, late sign. Anorexia, early sign. Okay. Question number 3. Okay. A client with liver cirrhosis is experiencing severe ascites and is scheduled for a paracentesis. Which of the following interventions should the nurse prioritize before the procedure? Number 1, administer 1 liter of normal saline IV. 2, instruct the client to void completely. 3, place the client in a prone position. 4, monitor the client's serum creatinine level. Ooh, you know this one. You absolutely know this one. Before I could even finish it, I saw the right answers on the screen. And the right answer is 2. That client has to void completely because we don't want to have a full bladder. Somebody's at the door. It's time. It's time for me to go. Okay. We don't want the patient to have a full bladder because during a paracentesis, you can puncture the bladder if it's full. So that's the most important intervention. Question number 4 is this. Here we go. A client has developed abdominal distension due to ascites and was given spironolactone. The nurse anticipates to monitor for, is it number 1, dysuria, 2, edema, 3, tachycardia, For hyperkalemia, what do you say here? And this is some pharmacology for you, but also being able to take a medication and apply it to a condition. It's room service, like we're eating around the clock here. And one of the things I love about being here in Africa is the fruit is so good. So I'm eating fruit like all the time. But anyways, so what do you say? Okay. The correct answer, if you put down number 4, hyperkalemia, then you understand that although we're giving a diuretic to reduce the abdominal distension in ascites, this diuretic that we're giving has a certain property that makes it different from other diuretics, meaning that it helps the patient hold on to potassium. Instead of getting rid of potassium, they're going to hold on to potassium. So this is like one of those questions that if you know this, you're on the right track for being a safe nurse. It really just means you took the time to study the certain portion of pharmacology that you can be safe. So look out for these kind of questions, especially if you have quick facts for NCLEX. The back of it is pharmacology. You'll be able to pick up these safety principles. And that's why I say quick facts for NCLEX is something that needs to be memorized. It's not a big book. It's not a book that's 10, 20 pounds that we're used to getting in nursing school. It's more like a short manual. So please take the time to memorize everything in that book because it is going to be extremely helpful for you. Hey, I got another question. It is a client with liver cirrhosis and ascites is receiving treatment with a low sodium diet and diuretics. The nurse notes the client is becoming increasingly lethargic, and the laboratory results show sodium levels of 125. What is the nurse's next best action? All right. Number 1, is it going to be encourage increased oral fluid intake to prevent dehydration? 2, administer a sodium supplement to raise sodium levels. 3, restrict the client's fluid intake to manage hyponatremia. Or 4, discontinue the diuretics to prevent further electrolyte imbalance. This is interesting. You got to talk yourself through this one. On the NCLEX, you have to be like, okay, wait, let me read this again. Like, this is one of the ones, you know how I say you do questions in a minute? Like, you should have questions in a minute. It might take you like 40 seconds to break this one down. The answer is obvious here, but there's a lot of unnecessary information. Okay, so, okay, here's the right answer for this one. The right answer is going to be number 3. Restrict the client's fluid intake to manage this hyponatremia. And the reason why this is very interesting, let me go back. So this patient has liver cirrhosis, but look, they're on a low sodium diet, okay? So they're not getting a lot of sodium already, and they're on diuretics. However, this information that we know, somehow it's not being translated to the physical because look, even though the patient's on diuretics, they still have an issue with fluid retention. How do we know that they are retaining still a lot of fluid? Because their sodium level is down. So in dehydration, we expect the sodium level to be up, right? The patient's dehydrated, they have a lot of salt in their body. When a patient's sodium level is low, and this is low, then we know that it's the issue of fluid overload. This is what we go over in diabetes insipidus versus SIADH. So when a patient has too much water, that sodium level is going to go down, irregardless that they're on diuretics. The diuretics may not be working. We need to switch to diuretics. So the best thing for us to do is restrict the fluid because the patient already has too much water on them. That is going to help to be able to increase that sodium level. So this is the next best action. Not that the other ones are entirely wrong, but this is the next best action. I hope that makes sense. This one was kind of tricky, but if you got it, then kudos to you. And if you didn't get it, if you see it on your exam, you will know what your priority is in situations where you have hyponatremia. Oh, so good. This is why I really don't care what else I have going on. I really do enjoy when we study on Mondays and Wednesdays. I think it is so important and key to our overall success that I never want to skip it. So I thank y'all for coming to class. I love y'all. I want to see y'all again in the V2 workbook. Get in the workbook, get in quick facts, watch the lecture videos. I spent a lot of time making the system, making sure you had everything that you needed to pass your NCLEX. So I'm spending the entire month here. I want you to continue to just follow along, check in, encourage us, encourage the nurses. We have a drive in the morning. It's a 4-hour drive to the next city. We're in Nairobi. And we're going to Meru tomorrow. And so it's a long journey for us. It'll be on a car. I wish we could fly, but no, there's not where we're going, inside of the villages and the small cities. So it's a 4-hour drive there and a 4-hour drive back. And we are going to thug it out in that car. It may be, how many of us was it in the car after we left Nakuru? It was 1, 2, 3, 4, 5, 6. Was it 7 of us in the car? It couldn't have been 3. Yeah, it was. It was 7 of us in a car just trying to get there. And so these are the adventures that I'm on here, but I love it. I love it because the nurses who are not able to travel to the big cities, it's like, some of us and in the United States, we're not going to Las Vegas, and nursing students, I know y'all not in Orlando, and we're praying for everybody in Florida. We see the hurricanes and the waters. God bless y'all. God bless y'all down there. But I understand that as a nursing student, as a struggling student, you don't have the money to necessarily travel to LA or, the big cities where events happen. So we want to do something entirely different and just going inside of the villages and talking to the nurses. And they have dreams. They have dreams. And coming to the United States is a total game changer. Don't ever forget the benefits of the professional development in the United States as nurses, the networking, the continued education, all of it is there. So I want to make sure that anybody that wants to come can come and feel safe, because one of the big things, and I get this from being here in Africa, is you don't want to come to the United States and be stranded and be alone, right? You come over here, it's a huge culture shock to live in the US. For those of us who live there, we're used to it. We're used to the speed of things. We're used to the cities. We're used to the stores. We're used to the politics. But if you're coming from a different world, you don't want to come in there and be stuck. So what I want to do is be able to mentor and stay with the nurses and make sure that even after they pass NCLEX, they get the job that they want. They feel comfortable in our culture. So the mission is huge. And I thank you, everybody, for all the energy that you're putting towards it. God bless you. I'm about to go eat some fruit. And then I'm going to bed for a couple hours. And then we'll get up and do it again. So God bless you all. And remember, you can, you will, and you must pass NCLEX.